I'm Susan Cole, and I'm thrilled to be joined by Professor Chloe Orkin from Queen Mary University of London. Hi, Chloe.
Hi, Susan. Great to be here.
Wonderful to have you. Chloe, there's been a great deal of interest about Mpox at the moment, but can we start by going back to basics? Can you explain what actually Mpox is?
So Mpox is a virus, and it's a virus which we call in medical jargon. You told me not to use medical jargon, but I'll say it anyway. It's called a zoonotic virus and has the word zoo in it. So it's a virus that comes from animals. We don't know quite which animals, but we know that it spreads readily in small rodents, such as squirrels, and it's spread into people that way. And that's what Mpox is. It's a virus.
Okay, and I understand that there are different clades of Mpox. Could you explain that, please?
So viruses can have different variants. We know this from COVID that there's, different variants. So we all now are public health professionals in the general public. Now that with COVID, we all know everything about viruses. So with this virus, it's always had two clades or variants, clade 1 and clade 2. And the clade that was responsible for the big global outbreak in 2022-23 was a subvariant of the clade 2 virus. So it's called clade 2b. And that clade came originally from Western Africa. And in fact, the outbreak could be traced back to a variant that it evolved from Nigeria in 2018-19. That's where it can be traced back to. But this particular problem that we're experiencing now is related to the clade 1 virus. And similarly, that virus is also split off and developed a subvariant called clade 1b. And that type of virus, the clade 1 virus, has been spreading and causing a lot of harm and a lot of pain and a lot of unhappiness and deaths in Central African countries for decades. Countries like the Democratic Republic of Congo, Central African Republic, Cameroon, such countries have been really suffering, but the majority of the infections are in the Democratic Republic of Congo.
And what's different now in 2024 to the outbreak in 2022?
So what is different is that, as I said, this virus has been circulating and causing a lot of harm for decades, but the numbers have really been going up. And in 2023, there was a very large number of cases, so in excess of 15,000 cases, more than 500 deaths. It's a lot of deaths. In 2024, we've reached that already, and it's now August, the year isn't over, and there's a similar amount of deaths. And what's happened now is that the virus has, for the first time, started to spread into other African countries where it's never been noted before. It spread to 13 countries on the continent. And we had our first European case last week in Sweden in a returning traveller. And that's the first time this clade 1 virus has ever been reported outside of Africa. Now, this virus is transmitting much more than it had been. And there are some changes in the virus, some mutations in the virus that's changed. And these changes may be resulting in the fact that it's more readily transmissible.
Right. And are people with HIV at greater risk from Mpox?
So people with HIV in themselves are not at greater risk of Mpox, the clade 2b virus. That's what we've found. But people living with HIV who have advanced HIV, undiagnosed HIV or not undetectable and have low CD4 counts are at high risk. And there is a very significant risk in people that are in that situation, and also people with immunosuppression for other reasons. And there have been some very, very severe outcomes, mortality, and sort of very severe infections. So this is the time really to encourage people who haven't had a test or people who aren't taking treatment, haven't managed to take treatment, to reconnect with services, because this is the time where we don't want people to have low CD4 counts.
Sure, thank you. And how is Mpox transmitted?
So Mpox is transmitted in a number of ways. So the most obvious and most important way is close skin-to-skin contact. It can also be spread through respiratory droplets if people are talking face to face, can be spread from contact with infected animals. And it's also thought to be sexually transmitted. It's been found both in sperm and in vaginal fluids, and that's something that's new. It's a new evolution of the virus. So that's how it's spread. And how much it spreads depends on, the number of opportunities it has to create chains of transmission. So there's a lot of people asking me, is this going to become a new global pandemic? It's more serious than the other virus. What's going to happen? So I think I'm going to remind everyone draw on the knowledge we've all developed in COVID, the whole public being a epidemiologist now. So we all remember the R number, and the R number is the number of new infections that come from a single infection. So if the R number is less than 1, so less than 1 person infected from every case of any infection, then it will die out. But if it's 1, that means 1 person will infect 1 other person. So for COVID, it's about 4 or 5, which is why it spreads so much, and it's respiratory. But for this virus, it's just above 1, so it will spread, but it's not respiratory. So it depends on how much contact people have while people are infectious. And that's why it spread a lot through contact. Sorry to interrupt you. That's why it spread a lot in 2022. So it depends on how much mixing there is, how much contact there is, how much skin-to-skin contact, and also how closely people are packed together in houses. And, when people are looking after each other, if there's any space in the home.
And one thing that seems really concerning is the number of death in children, and it's spreading with children quite a lot. Why would you say that is?
So Mpox has always been known to be more dangerous to children and babies particularly. But in this clade 1 outbreak, and in clade 1 in general over the last however many years in DRC and Central Africa, people under the age of 15 are the most affected group, and children under 5 are the most likely to die. In fact, around 80% of the deaths have been in children. So it's important to recognize children mix. They touch each other, they touch everything. They're in the nursery, so it spreads readily, and their immune systems are less well formed. So that's happening.
Chloe, could you tell me a little bit more about why Mpox is spreading at the moment in 2024?
So in the DRC, where 96% of the cases are, the ways that it's spreading are there's a lot of problems in terms of militarized zones, and there's displaced people, and those displaced people are in camps, and in the camps conditions are not very good for people. They're not very sanitary. People are squashed together, and it's skin-to-skin contact, close contact. So if one child is infected, it spreads to the parents and to the other children, and it's spreading. Additionally, it's also entered some networks of men who have sex with men in those countries, and obviously in many cases in these countries, being gay is criminalized, and that means people are less likely to come forward when they have symptoms. Things can spread. And also it's entered into networks of sex workers, and that means that people are having sex with sex workers, and then sex workers having sex with other people, they're getting it, and it's spreading in that way as well. So it's spreading in heterosexual networks and in gay networks, MSM networks as well. And
what's the risk to pregnant women of Mpox?
So there is a risk to pregnant women. People are more likely to have stillbirths, and also pregnancy is a state of relative immunosuppression. So pregnant women can also become more unwell.
Right, thank you. And there's quite a lot of confusion at the moment about the actual symptoms of Mpox. Can you talk to me a bit about what the confirmed symptoms of Mpox are?
So 10% of people who have Mpox will not have any symptoms, so it can be asymptomatic. There can be some very mild cases. People might feel a bit tired with 1 or 2 little spots. But in most cases, people would feel quite fluey, headachy, sore glands, and then would have a rash, which typically looks like blisters, and may have sores in the mouth, on the genitals, in the rectum, particularly. And these are very painful, can be very painful.
And can it be transmitted if someone doesn't have any symptoms of Mpox?
Yes, it can be transmitted up to 4 days before the first symptom, so it is possible. But it's not like respiratory virus, which is massively infectious beforehand, but it is infectious, yeah.
And is there a vaccination against Mpox?
Yeah, so the smallpox vaccine can be used against Mpox. It's called Imvanex or Jynneos, depending on what country you're in. And you need 2 doses 28 days apart. So that can be used, and it can, in those people who've been vaccinated, it is very much likely to work in both clades, and it will reduce the disease severity and possibly stop infection, but definitely reduce severity. When I say possibly reduce infection, the rates of getting infection are much lowered, but it's not an absolute guarantee that if you've been vaccinated, you won't get it, but the risk is much, much, much lower. So I think the other thing to say is those people that have been vaccinated in 2022, the immunity is likely to be still there. It's not much known what happens beyond 2 years, so we're not sure how quickly it's going to wane. I think the other question is whether if you've had clade 2B Mpox, are you going to get clade? Does it protect you against clade 1? The answer is we don't know.
Right.
Probably, but we don't know.
And is there any treatment for Mpox?
So there's a treatment called TPOXX or tecovirimat as an antiviral agent, and it was used during the clade 2B outbreak quite a lot in well-resourced countries that could afford it. And it was thought by clinicians to reduce the duration of the lesions and also thought potentially to reduce severity. And I say thought because by the time we got the drug and were able to start the trials, the cases were going down so much that we couldn't run the trials. But a big trial has been done in DRC in the clade 1 virus, and what's been found, unfortunately, is that it doesn't work. However, what was also found, which was really interesting, is that everybody who got Mpox in this situation in the DRC had access to hospital care, antibiotics, nutrition, hydration, whatever hospitalization support they needed. And given that this was the case, the mortality rate across both groups was 1.7%, which is much, much lower than what's being generally reported from the DRC in this clade. And that suggests that the quality of care is very important in determining the mortality rate, which is good news in the sense that, it's less fatal if you get the right care. It doesn't help the people in countries where they don't get the right care, but it's slightly less alarming that with the right care, mortality rates are not 10% or 4%, they're more likely to be 1.7% or close to that. Having said that, that is still at least 10 times higher than the mortality that we saw in the outbreak of 2022-23, where it was 0.1%.
Thank you, Chloe. And you raised the very important point about these interventions being available to people in rich countries. How significant is it a problem that there's inequity in access to treatment and vaccination?
Well, the treatment at the moment isn't working. But what's really terrible is that there's no access to vaccination in these countries. And despite the WHO declaring a PHEIC, a public health emergency of international concern in 2022, seeking donor funding of 34 million, nothing was given. And this is not a disease that anybody prioritized in the well-resourced settings. It was a disease occurring in Africa, and those lives were not valued. And the morbidity and the pain and the suffering of those communities was not cared enough about for anything to have happened. And now this outbreak has been rising, and really people have been dying. I told you there were 500 deaths in DRC last year. And now the minute there's a case in Sweden, now the whole world is in a panic station, and I'm being asked to give interviews, and now everybody cares about Mpox again. Sorry.
Yeah, absolutely. So what international response would you say is needed now to tackle this outbreak?
So a public health emergency of international concern, the reason to declare that for the World Health Organization is to help with a coordinated collaborative response to the outbreak. And this means helping to get diagnostics so people can be diagnosed. It means freely available community testing. It means non-stigmatizing sort of messaging. It means the government's being forced into prioritizing this and prioritizing the care and focus on it. And it means vaccination. It means people the company is not marketing the drug in Africa. So the countries are reliant on donations at this point. And what the WHO is doing is trying to increase procurement, which will increase access. But what really needs to start happening is that countries in Africa need to be able to produce the vaccine themselves, to do vaccine production, so they're not dependent on donations. And there are amazing scientists in Africa. The investment needs to happen so that, this does not happen. They don't not reliant on donations and people prioritizing diseases that are occurring.
Thank you. And you raised stigma. What can be done to prevent stigma around Mpox?
Well, I think stigma around Mpox, the same stigmas that occur, for people living with HIV, people who sell sex are, people that are, migrating, people that are refugees, asylum seekers. Unfortunately, these are the people that are being affected most by this outbreak, and people in a country like DRC where, it's not a country that people generally travel to. It's a country which has a lot of war and militarization. So these are not the people that it's not like a disease that people are, worried that they're going to get themselves, in terms of the decision makers. And I think that's the problem. So there's very little focus on it. I think also there's a lot of toxicity around vaccination and the whole dialogue around vaccination, a lot of binaries, and a lot of, differences of opinion around vaccination. So obviously this whole debate is about getting access to vaccines. So some people think that there shouldn't be vaccines, and that vaccines are very harmful. So obviously all of this toxicity around different perspectives is coming in, adding to stigma, prejudice. So it's quite a hot topic. And I can tell you that the interview I did on Sky on Saturday morning was heavily trolled around the population at risk, migration, LGBTQ plus community, me as a member of the LGBTQ plus community, vaccines. So it is a hot topic, and it's certainly quite divisive as a topic already.
Absolutely. And there are so many parallels just in relation to HIV and the community who are most affected, and people facing intersecting forms of stigma around Mpox. How important is language around Mpox to tackle some of this stigma?
Language is really important, and that's why the name was changed from monkeypox, which was A, misleading because it didn't actually monkeys don't spread the virus, and B, it was a racist slur and people found it discriminatory and they wanted the name changed, understandably, so the name was changed. So I think that was helpful, but I think it is, as you say, it's a disease which is an infection which has spread in sexual networks and has something to do with sex, and anything that has anything to do with sex, unfortunately evokes morality, although every single person in the world is born because their parents had sex. So actually, I don't know whether all of this moralizing is some form of self-hatred.
Absolutely.
Yeah.
And what advice would you give to someone who thinks they may have been exposed to Mpox?
So I think it's important to recognize that returning travelers to those areas, there is a risk, a significant risk of coming back with Mpox and be mixing with affected communities. So if that's the case, I think it's a high index of suspicion. If you have flu-like symptoms, if you get a rash, isolate yourself, contact services. Don't mix with people. If you've been in contact with someone, if you're coming back and that's your situation, that's the situation. If you interacted with someone who has Mpox or you think may have Mpox, isolate. If you have lesions, don't have any skin-to-skin contact. You can spread through respiratory droplets. Do your own washing. Make sure you contact services. If you've been exposed to somebody, it is possible to give the vaccine as sort of a post-exposure prophylaxis, or PEP, to prevent you getting sick. And that's most helpful if given within the first 4 days. So ideally, don't wait for 4 days, contact someone quickly. and try and get access.
Okay, brilliant. Thank you. And is there anything else that you'd like to add around Mpox in 2024, Chloe?
Yeah, I think Mpox in 2024 is our collective shame, really. This should not have happened. This was preventable. I'm constantly asked about if I had to give a penny for the number of times I've heard the word lessons from COVID. I can tell you this is a ringing example of how we have not learned any lessons. And pandemic treaties are still not in place. This is a high consequence infectious disease. It's a cousin of the virus that nearly eradicated the world, smallpox, and yet still, because it was affecting Africans, nobody's done anything about it. And now it's spread once again. We are all human beings. We all share common humanity wherever we live. And we live in a global interconnected world. So even if there's a complete lack of humanity, there's a complete stupidity to thinking that a problem that's an infection that's arisen in one country is no risk to anybody else. We are all at risk. We are all people. And although I've been told to retire this phrase, I'm not going to retire it. Viruses do not discriminate.
Absolutely. I agree 100%. Thanks very much, Chloe.
No problem. Lovely to speak to you.
Yeah, and you. Thank you.